If you say your first name, and then we'll go ahead and get started.
I'm Kendrick.
I'm Ashley.
I'm Akira.
I'm Sarah.
I'm Bryce.
I'm Shaka. I'm Hema.
All right, you guys. So this presentation is going to go over just, is it ethical to give a spouse an HIV status? So the Florida protects spouses, but it also protects against giving that information to the spouse if their spouse currently has a STI. That's the Department of Health also does that as well. So a couple of stats I wanted to go over with you, but in the meantime, the CDC reports that if you are regularly taking your medication, your viral load can go down to 0. If it gets down to 0, they are not requiring any healthcare professionals to inform the community. That is what the Florida law states. The CDC said also, if you do not take your medications regularly, you have doubled your chance of infecting the community. So it goes from 3.9 to almost 19% out of 100 people, right? So 19 out of 100 people. HIPAA was created in 1996, and that is a law that protects against giving out patient information. Now, it's very detailed. Doesn't just say that, right? But it was created for healthcare workers to be able to protect their patients, but also for us to be legally responsible for making sure that we don't give it out, right? It also really helps with the hospital field with keeping up records for 10 years, right? So we keep patient records for up to 10 years here in the state of Florida, but it also is going to protect those spouses. And so the example that I want to give to you guys today, and I really want you to think about this, is it ethical? Should I tell a spouse that they may be next to someone that has HIV? And the answer is not black and white, unfortunately. And so the example that I have is I was working in OBGYN at a time, and we had a patient. She was from a different country. She was from Africa, and she had HIV. She was currently pregnant, and she had HIV. And her husband did not know that she had HIV. She was taking her medication regularly. We had to hide her medication because she could not have it in the home. She kept it in a different bottle that looked like vitamins. And so she was taking it and her viral load was undetected. Keep that in mind, right? She was undetected. I was really new to OBGYN at that moment. And I was like, oh, shouldn't we tell her husband? Like, what if she misses a couple doses, right? And the provider pulled me inside and said, no, we are not to tell him. That we have to outweigh her safety versus her exposure, right? And so they educated her of keeping up with her medications, making sure that she's staying on top of it, but he would have killed her. In their country, having HIV is a death sentence. And so her safety and her child's safety was way more important than protecting her status to her husband, right? And so the provider kept her secret, coordinated with the hospital to have a cesarean, which is a C-section. And she is still living with HIV, but she's undetected and has now been for about nine and a half years. So she is doing well, but the husband does not know. And so that brings the question of what is too much, right? When do we come as healthcare providers and we say, we can no longer protect your status? We have to tell the community. And so the Florida state law does tell us that we are only to release that information to the Department of Health, and the Department of Health will determine if the safety outweighs what the community will affect. If that person is compliant, if they are taking their medications regularly, and if they are continuously coming back with a 0% viral load, or it's like a threshold of 5% and under, I believe what the Department of Health does, then we are not to tell a spouse. And so that HIPAA law also protects spouses as well. It's not just going to throw them out to the winds, but if the safety is a concern, we do not tell. So our OBGYN at that point delivered a safe, healthy baby boy, and he moved on with his life. And so she is safe, baby is safe, and her other children are safe. Now, I ask you, would you want to be the spouse? Right? Would you want to be him, knowing, not knowing, right, that you're laying someone that if they are negligent in their medication taking, you could possibly be at risk for contracting something, right? But then on the other side is you could cheat, right? You could also go out and that can still happen to you, right? And so we have to really draw, especially in healthcare, draw a super fine line into what is right what is ethical and what is non-ethical. It's not black and white, right? It's colorful, it's gray. There's a lot of opinion, decision making, a lot of interpretations of the law. And so the CDC does state that in Florida, HIV results are confidential, but should they be to everybody? That was my question, right? Would you want to be that spouse? Would you want to be laying next to someone that could have that? I don't know, some days I wonder, right? My safety, her safety, our safety. And so I want you guys to really go, taking away from this message is, when do I step in? And when do I say, you know what? We want to protect her. Any questions? No? Okay, we're good.